Hey, it's your old pal, Dr. Steve, and welcome to the SARS-CoV-2 COVID-19 Updated Situation Report for July 19, 2020. This is the 14th in a mostly weekly series. Previous episodes are available and have general information about the current pandemic, antivirals, vaccines, and basic science that are not necessarily covered on a weekly basis. So go back and check those out. Okay, let's get started with the statistics for this week. The world is sitting at 14 million cases. USA has 3.7 million and ranks 11th in deaths per population, although the U.S. ranks first in number of cases. Brazil coming in second at 2 million, ranking 13th in the world, and Russia at 764,000, ranking 36th in the world for deaths per population. Florida is showing increase in new daily cases. We keep hearing about this surge in cases, and I'm going to show you where this is coming from. Some of this is testing, no question about that. A lot of this are actual new cases, and the reason we know that is because if we look at new hospitalizations, we can see they're on the rise as well. Although relatively low, Florida had 340 new hospitalizations. And remember, this data may not be completely up to date. This stuff may sit on people's desks for a while. You can see these sort of periodic dips in the data. It sits on someone's desk and then it's shuffled out. That's why we use the 20-day simple moving average, because it just gives us a better picture, but you can see there's a definite increase. So Florida's had 4,895 deaths total, and their deaths per 100,000 have been 22. So 22 out of 100,000 people in the state of Florida have succumbed to the disease. Let's look at South Carolina. South Carolina also increasing in new daily cases. And but hospitalizations, now that is obviously reporting. So again, we've got to look at the smooth moving average. They've had 1,132 deaths in South Carolina, and again, 22 deaths per 100,000 population. So let's look at New York. New York had declining daily cases. If you remember, go look at last situation report. Things were looking pretty good. Now they've sort of plateaued at a moderate rate of about 700, maybe 750, somewhere in there, new cases per day. And their daily deaths are declining, and significantly. That's a definite downward trend. And on the very last data point, New York had 15 deaths, which is pretty low. However, New York as a state has had 32,478 deaths, and the total deaths per 100,000 is 167, so it's quite a bit higher per population than, say, Florida and South Carolina. So it's very interesting and tragic. Oh, by the way, this data all comes from Stout Labs. So go to covid.stoutlabs.com and you can play with these numbers yourself. Here's the epidemic curve showing some declining in some parts of the world, particularly Europe, but still spreading out of that curve, showing overall increases in the Americas. We talked about R sub T multiple times. This is the average number of people who become infected by an infectious person using real-life data. So the R sub 0 of SARS-CoV-2 is something like 2.4. So in theory, given a population of susceptible people, one person is going to, on average, infect 2.4 people. Now, of course, you'll have some outliers. You'll have a bunch of people won't infect anybody, and then you'll have one person infect 50 people, in a church choir or something. But, these are averages. The R sub T are calculated using real-life data. So when the R sub T is greater than 1, you'll see increasing cases approaching that geometric curve that we do not want to see. And when R sub t is -1 or less than 1, the virus will stop spreading. So, and then when the R sub t equals exactly 1, you'll see linear increase in total cases because 100 people will infect 100 people, which will infect 100 people. So this was 3 weeks ago. You can see about half the states had a positive R sub t and about half of them had a negative R sub t. And then 2 weeks ago, it was about 2/3, 1/3, and then here it is today. I don't know what you would call that. 4/5, 1/5 maybe. So the states with the highest R sub t right now are Montana, West Virginia, Arkansas, Indiana, North Dakota, Wyoming, Indiana, Colorado. So it's not necessarily this sort of southern phenomenon we've been hearing about. I'll give all props to Maine, who has a significantly lower R sub t than any state in the union right now. Good job, Maine. Well, I'll give you one of these.
Give yourself a bill.
And Utah, New Hampshire, and South Dakota also looking very good. So we'll get them. But you'll also notice, I hope, that the highest, which is Montana, is right at like 1.2, 1.4, so nowhere close to that 2, where we really see the geometric curve. Obviously, we want to see these things lower, but I want to show you that most every state has done pretty well. I'm going to show you all 50 states. You can see these are the R sub t curves over time. And many of the states dipped into the green, at least for a period of time, and then reopened, and then their R sub t has increased again. And this pattern is repeated over and over and over again. Louisiana, Maine, as we said, has had a nice decline. Well done, Maine. Michigan had a significant decline, then a peak, and then it's declined back down to an R sub t of 1.08. So they're going to see linear growth with a little bit of increase over time. And here are the last 11 states, and you can see. So everyone is doing a pretty good job. Good job. I was just in South Carolina. They're shutting everything down again. Their R sub t is back down to about 1. They really want to get it below 1 so that they can see a decline in cases and hospitalizations. And bravo to them. All right, drug news. Things to make this go away. We're still waiting for favipiravir published data. It was, we were sort of promised mid-July, and now it's July 19th, slightly past mid-July. There was some Russian early phase trial data that's not been published anywhere that I can find, but did report that the drug was safe and effective, and there was 80% improvement over standard therapy. Fever resolved in half the time, 3 days versus 6 days. And remember, this is a pill that can be given at the onset of illness. You don't have to wait till people are in the hospital. The whole point of this is to keep people out of the hospital. If we can reduce hospitalizations and reduce deaths enough with just this one drug, we can all kind of go back to work and start treating this like it's influenza. 65% tested negative after 4 days versus around 33% for standard therapy. There is an Egyptian study that I noted was marked completed on clinicaltrials.gov, but they have not published their data yet. So I'm still holding out hope that favipiravir will lead us out of this while we're waiting for vaccine and herd immunity to provide a way out. So there's this question about immunity over time. And my hypothesis, I've been talking about this on Twitter, is that all the coronaviruses, and there are 4 or 5 that circulate all the time and cause common cold, that all of them probably started this way, as a pandemic that made older people sick, and but they've been in our environment for so long now, thousands of years, tens of thousands of years, who knows, that they no longer have this effect on us. because kids get exposed to them when they're young. And so what if you can get infected again if the reinfection doesn't cause a serious illness? And the reason that we're having so much problem with this is it's a novel coronavirus, and people my age have not been exposed to it before, and we're the ones who get really sick. And, of course, there are some young people that get sick. And what people don't remember is that 10,000 people in the United States die every year from coronavirus infections, even the quote-unquote good ones that just quote-unquote cause the common cold can take people out if they are vulnerable to them. So I have a sneaking suspicion that what's going to happen with this virus is it's going to run through the population, and those people that got infected can get infected again, just like you can with the other coronaviruses, but the repeat infection will be very benign. And all these kids that are being exposed to it now will grow up, and when they get older, when SARS-CoV-2 comes through again, it will just be a common cold for them. That's my guess. So we'll see. The Oxford vaccine does show some promise in early data pool, and the blood samples from the group of volunteers produced both antibodies and killer T cells, which is important. Because it's not immunity isn't just about antibodies. We keep hearing, oh, the antibodies fade. Well, that doesn't mean that the body doesn't remember the infection and can't fight it. It just means that you're not detecting antibodies. So even if the antibodies fade, the T cells can stay in the circulation for years. And of course, however, this result is not proof that there's going to be long-lasting immunity against COVID-19. Because there's no long anything. We don't have any long-term data on anything with this virus. What we have is going back to November or December of 2019. It hasn't even been a year yet. Now, AstraZeneca is the drug maker that is partnering with Oxford, and they have agreed to make 2 billion doses if the final trials are successful. So that's awesome. So good for them. And hopefully it will be relatively inexpensive. So that's all I've got for you this week. Stay healthy, be smart. Physical distancing is still important. We've got to get those R sub T's down below 0. Come on, you can see from those graphs we can do it. We're very close. Vigorous hand washing. Soap is better than gel, but gel is better than nothing, and cloth face coverings still matter. If we all did that, even decreasing, just say it decreases infection by 10%. When you've got 3 million people that are infected, that's 300,000 people that could have been spared. So I still am a proponent of cloth face coverings when you go out in public, anytime you're going to be in a place where it's impossible to physical distance, which is just about everywhere. But don't lose hope. There's absolutely light at the end of the tunnel. Check out our Twitter at Weird Medicine, podcast at thelaughbutton.com/podcast, and at SiriusXM, Faction Talk on demand, 8 p.m. Eastern on Saturdays, and 5 p.m. Eastern on Sundays, and on demand is the best way to listen to it. All right, until next time, thanks for watching. We'll see you in 1 week for the next Weird Medicine COVID-19 situation report.